right? I want to welcome everyone here today for this series of news conferences we've held, really going back all the way to March on COVID. And again, I want to say, as I always do up front, this is not about the COVID situation nationally or even statewide as much as it is about the local situation, an opportunity to hear what's happening from representatives of our healthcare community with St. Francis Bon Secours and Prisma, and to talk about the numbers and where we stand as a community, and talk about what we all need to be doing in terms of doing our part to keep the numbers, the spread, if you will, contained. We do have some good news today in stark contrast to previous news conferences here. We have reports from our medical community of some good news. Numbers showing a decline for a period of time and things holding steady. But the most important point is we have some good news that people are doing their part. It's not perfect, but the fact is wearing a mask, which has been the emphasis for so long in this community and so many other places, here locally has made a difference. And that's not just my opinion, the city's opinion, that's the opinion of healthcare professionals, and I know they're going to speak to that. But we all have a part to do in keeping ourselves, keeping our community safe, and keeping us on a good track. I also want to make a point today that we do this for a lot of reasons. We all want to get back to normal. Goodness gracious, we all want to get back to normal. And schools are reopening and all the issues with that. But I want to put a particular emphasis on small business. I've spent a good bit of time talking to retailers and restaurant owners in our community in the last couple of weeks, and it's still a very tough situation. Our small businesses are hurting, and we need to all do our part to think local, to shop local, to think about our restaurants, and to think about our retailers and how you can, wearing a mask, continue to go there for your meals, to show up in the retail stores. We have to think local, help our local businesses, and the best way we can do that is to wear a mask, especially in inside quarters, and to shop local. So it's an urgent message. We all have to do our part, and now more than ever, it's important to do our part. This is really, in many respects, kind of our last chance to get it right, and we want to continue to focus on that for the benefit of our businesses and all of our community. With that, these news conferences are not about anything I might say so much as hearing directly from our healthcare professionals in terms of what's happening on the ground, what's happening in the hospitals, what's happening with the numbers. So with that, Dr. Marcus Blackstone with Bon Secours St. Francis will be up first. Thank you.
Thank you, Mayor. I appreciate the opportunity to be here this afternoon and actually come with good news. First, I want to say thank you. We have asked you, pleaded with you, essentially begged with you to wear a mask, and it's paying off, from our standpoint. As of today, we're at about 50% of COVID patients that we were 4 weeks ago. And we're seeing, just a very slow, but somewhat of a steady decline. Not meaning that, we're not still seeing COVID positive patients, because we are, but we're not seeing them in the large numbers that we were. Bed capacity is increasing from that standpoint. So we're in a much better position than we were. Our trajectory is going down, and that's really important, from a bed capacity standpoint, but also as a community, as the mayor said, to hopefully start, getting to a point where we can get some normalcy back, although I still think it's going to be different. Normal is what we consider a new normal. But as we move into flu season, as you probably saw, DHEC got their first reported case this week. It's going to be really important, because the same mechanisms we're using around masking and social distance hand washing will also help us, as far as the influenza, which is always a very busy time for us in the fall. So again, I want to say thank you. What I do want to is I always want to take an opportunity around education and what we see. There are still two areas that we're seeing exposures, and those two areas are actually in-person church services where masks are not being worn, and funerals. So just really be diligent about those as more and more churches go back to in-person services. As people go to funerals, we know that, people like to get together, but we're still seeing positive cases come out of those two situations. So I wanted to really kind of call them out specifically. The mayor previously has talked about some of the businesses who have also, put masking in place that made a big difference. So just wanted to share that with you. And with that, I'll actually turn it over to Dr. Eric Osman and then Dr. Robin LaCroix from Prisma, and they'll let you know what's going on in their hospitals.
Thank you, Dr. Blackstone. So I do want to give you a report from Prisma, and as Dr. Blackstone said, we have noticed a significant decrease in the numbers of COVID-19 patients admitted to the hospital. When we last spoke in July, we had over 300 patients on the inpatient side of our 11 hospitals in the upstate and Midlands. And as of today, those numbers are below 150. So that is a fairly significant decline. Now I do want to caution folks and keep in mind that in May we were, in the numbers of 75 to 90. So we still have a ways to go, and certainly more work is required. And keeping up the things that have gotten us from 300 to 150 are absolutely essential. So wearing the mask, staying 6 feet away, avoiding congregational settings. All of these things are going to be absolutely essential for us to continue to achieve those declining numbers. So I think that's very positive. From the standpoint of our capacity in the system, our capacity is good. We have done a excellent job, I think, of spreading the volume of patients across our 11 different hospitals. We are operating at essentially 100% capacity for surgeries, for procedures. The hospital remains an incredibly safe place for people to come to. We maintain all of the protective measures and guidance that we've had in place since early in the pandemic. So I'm very cautiously optimistic looking into fall that if we keep doing these things as a community, we will continue to see these declining numbers. We will be able to manage this effectively. A few key messages going into fall. Absolutely, this mask is essential. I mean, I live in Greenville. I'm out in the community, and as the mayor said, and as Dr. Blackstone said, it's really great to see everybody wearing a mask and doing all these things that are incredibly helpful, such as maintaining distance, good hygiene. If you're sick, stay home. And this is a particularly important message going into the flu season. If you're not feeling well, make sure you stay home and separate yourself from others. So as we enter into September, get that flu shot. That will be very helpful. Keep up all of the things you've been doing for COVID over the summer, and as the flu season comes on, hopefully we'll manage that as well as we've been managing COVID in the last month. So with that, I know you're going to be very interested to hear from Dr. Robin LaCroix, so I will turn it over to her. Thank you very much.
Good afternoon. Yes, many of the school districts have already started school. Many of the private schools have already started, and certainly Greenville County will be beginning, and our other upstate counties. And so as a parent and also as a pediatric infectious disease specialist, I've had the opportunity to work with the schools, which has been great. They have put a tremendous amount of thought and preparation into making sure that this can be a very safe situation for the children as they return. I think some of the things that the parents can do to help prepare their children is to reinforce what the school's asking you to do with the masking, reinforcing to the children that this is important. The hand hygiene, again, very important. The schools are going to be focusing on this.
Doctor, can we get you to pull the mic a little closer, a little lower? Thank you.
You're welcome. A little shorter than my predecessors here. For parents to really set the bar for their children, and children cue off parents' responses, and being positive about wearing their mask at school, and being positive about doing their hand hygiene, and And monitoring your children, again, to Dr. Osmond's point, if you suspect that your children are getting sick, keep them home from school that day. Take a little time to assess how they're doing. This really is going to help the school district, help all the children who are together so that a child doesn't attend school that's ill. And the school districts have addressed this with their attendance policies, and they've been able to make sure that parents feel comfortable to assess their children before they come to school. The children, again, reinforcing to them, they're going to be so excited to see their friends. They've been away for a while, and so reinforcing that social distancing and that the hugs that used to be there may need to be air hugs for those children, and helping manage and speak into this before the children are back in the full educational setting. I think the influenza issue is always a concern. Children suffer from influenza as well as adults, and certainly immunizations will begin to be offered. The vaccine manufacturers are shipping those. Those will be rolled out in the next couple weeks. So families contacting their healthcare providers to get ahead of the curve and to get their children and themselves immunized against influenza. I'll be happy to answer any questions.
We'll open it up to everybody.
Okay.
Hi, Ayla Roan with WSPA. Really, anyone can answer this question, but it kind of goes back to the city's campaign with the mask up signs that we see throughout the city and the hand sanitizer, and I think there's even a hand washing station maybe down by the CVS. Maybe we can speak to how that campaign, seeing those things pretty prevalently in our community, has kind of contributed to the decline that you all have seen as far as patients entering the hospital.
So we really think that that's actually, made a difference, and I'll tell you, there's another one coming out shortly with us in Prisma around masking up and hand washing, because we felt like that, multiple people have done them, around town and in the county, and they've been affected. So we're fixing to come back with another one just to make sure that we keep it forefront in people's mind.
I know that also previously we've talked about how there is the potential for this to get worse come the fall. So although that we're seeing a decline in the numbers now, which is obviously a good thing, can you just reinforce the fact that, we have to keep doing what we're doing to keep those numbers where they are and get them even lower?
Right, and Dr. Osmond, Dr. LaCroix both did that, but I think, the big thing, masking, hand washing, if you're sick, stay home, don't go to school, don't go to work, but also, getting the flu vaccine. I mean, that's going to be really important. It's important every year, and we try to push it every year, but I think it's, exceptionally important this year given the situation we're in.
Jane Rebelo with WYFF News 4. Two quick questions. The first would be, there's some questions that we get from viewers about the numbers of people who have died. As you all report those numbers to DHAC, is it people who have died from COVID or people who have died with COVID?
Okay, so you're going to put me on the spot here, and that's fine. What we report is deaths that people that have a positive COVID test. So what we report is, is a patient who dies who has a positive COVID test. That's what we report to DHAC.
So it doesn't necessarily have to be that COVID was the cause of death, but when they died, they were positive with COVID.
Right.
Great. The other question would be, we've heard Dr. Fauci speaking now about maybe temperature checks aren't that important. Where do you doctors weigh in on, because that's kind of the first thing, we're still taking temperatures and we're still looking at that as a measure of whether or not someone may indeed have the virus. And the other question would be, I've heard conjunctivitis might also be a sign, but that's not one that we're hearing about much.
Right.
How do you three weigh in on those two signals?
So, from our standpoint, as a system, you routinely look at what are the recommendations from the CDC and other places, and that's continually being evaluated. I think, from our standpoint, we haven't backed off of temperature checks. We still think that, any kind of barrier, that we can use to potentially catch, somebody with a fever that they're not aware of from that standpoint is still going to be beneficial. As far as the conjunctivitis, Dr. LaCroix, you want to address that?
So conjunctivitis and even skin rashes have emerged as we've learned more about the disease and its multitude of ways that it can manifest. And so certainly conjunctivitis, particularly in combination with other things, respiratory symptoms, has been well described. That also describes a number of other viruses. So that's where having someone who is having a symptom seek either going through one of the online screening tools to determine if they need to be tested, or seeking care with their provider, which now can be done through a number of different ways, both via telehealth and also via in-person visit. But it allows you to put the whole clinical picture together, and that will give someone a better idea, because we know conjunctivitis is common with other viruses as well, but definitely has been described.